Hello and welcome to NDTV 24/7. I'm Rohit Wellington. Let's begin with our top story. The government has decided to cancel the Class 12 board exams in the interest of the safety of students. It's a decision that has huge ramifications for lakhs of students in the country. At a meeting chaired by the Prime Minister, it was decided that CBSE Class 12 boards will be cancelled this year. The Prime Minister said that the decision has been taken in the interest of students. He said that health and safety of our students is of utmost importance. There would be no compromise on this aspect. There's anxiety among students, parents and teachers which must be put to an end, he said, going on to say that students should not be forced to appear for exams in such a stressful situation. All stakeholders need to show sensitivity for students. The government said that it was decided that, like last year, in case some students desire to take exams, such an option would be provided to them by the CBSE as and when situation becomes conducive. Results will be as per a well-defined objective criteria in a time-bound manner. Now, ICSE Class 12 exams have also been cancelled for this year. The ISE students will be given a chance to appear for exams at a later date, and the criteria for assessment will be made available soon. That's what the board has said. Now, India reported 1.27 lakh new COVID cases, lowest daily rise since the 9th of April. 2,975 deaths were reported in the last 24 hours. India's second COVID wave seems to have abated just as quickly as it had worsened. Just weeks ago, we were reporting the highest ever daily cases, and now many parts of India are recording the lowest case and death numbers since March. Meher Pandey has this report.
The whiplash of the second wave is showing signs of relief, a sharp fall in cases and deaths. At the peak of the first wave on 16 September 2020, India recorded 68 cases per million population. Cases fell to half of that in 45 days. The peak of the second wave was 8th May, at 284 cases per million, and cases have halved much faster in just 22 days. Haryana, Delhi, Uttar Pradesh, Rajasthan and Bihar are the states showing the fastest fall in cases, with all recording between 55 to 65% fewer cases this week than the week before. Some, like UP, are now beginning to ease their lockdowns. However, in some states, there are questions being raised on the decreasing proportion of the more reliable RT-PCR tests versus rapid antigen tests, and whether people in rural areas are coming forward to be tested despite symptoms. Despite these questions, availability of hospital beds and less stress on medical facilities does indicate a rapid fall in cases. Epidemiologists offer two main theories. One is, the sharper the rise in cases, the sharper the fall. Cases were growing exponentially in April and early May, so the localized COVID restrictions on movement and gatherings thwarted the transmission of the virus in more instances and thus brought down daily case numbers faster at a higher caseload than the same restrictions will do at a lower caseload. But Dr. Jugal Kishore, an epidemiologist at Safdarjung Hospital, does not give credit to the lockdowns.
जो म्यूटेटेड वायरस घूम रहे थे वो बहुत तेजी से उन्होंने लोगों को इन्फेक्ट किया और ऑलमोस्ट मेरे हिसाब से 80-85% लोगों को इन्फेक्शन हुआ. ये तो सीरो सर्वेलेंस होने के बाद में पता चलेगा कि कितने लोगों को इन्फेक्शन हुआ. तो ये मुझे ऐसा लगता है कि कोई लॉकडाउन का इफेक्ट नहीं, ये वायरस की कैरेक्टरिस्टिक और जिस तरीके से ये समाज में दूर दराज के इलाकों में फैला, वही एक रीज़न है.
Testing as well as containment has worked in these 6 to 8 weeks that we have done it. However, it is not a sustainable solution. We have to remember that our vaccination is being ramped up, and by December we hope to have the whole country vaccinated.
Although there is some room for optimism about the fall in cases, there is none for complacency. We are at a critical juncture and public policy on vaccination and COVID restrictions needs to respond accordingly. Meher Pandey for NDTV.
India's daily COVID death count has dipped below 3,000 mark after 35 days. But Kerala is showing some worrying trends. The 2-week deaths have doubled. Sneha Koshi has this report.
A 22-year-old son waiting at the mortuary for a final fleeting glimpse of his mother before she is taken to the cremation ground.
ഞങ്ങൾക്ക് ഒരുപാട് പേർക്ക് പോസിറ്റീവായി. ഇപ്പോൾ കുഴപ്പമില്ല, എല്ലാവരും വേറെ ആർക്കും ഇത്ര സിവിയർ ആയിട്ടില്ല. ഏരിയയിൽ ഒരുപാട് പേർക്ക് ഇങ്ങനെ വന്നിട്ടുണ്ട്, അടുത്തടുത്ത വീടുകളുണ്ട്. അപ്പോൾ അങ്ങനെ എങ്ങനെയെങ്കിലുമൊക്കെ വന്നിട്ടുണ്ടായിരിക്കണം. ഇത് ആദ്യം മനസ്സിലാക്കിയില്ല, പിന്നെ ടെസ്റ്റ് ചെയ്തപ്പോഴാണ്.
For the last 2 weeks, COVID deaths in Kerala have more than doubled as compared to the first 2 weeks of May, from 45 deaths on May 1st to the highest of 198 on 29th May.
ഏകദേശം ഒരു ദിവസം നമ്മൾ 5 ബോഡി 6 ബോഡി എടുക്കുന്നുണ്ട് ഒരു വണ്ടി കണ്ടിന്യൂ ആയിട്ട്. പണ്ടൊക്കെ കുറവായിരുന്നു.
The case fatality rate though is still at 0.35% in comparison to national average of 1.18%. Experts say with the 7-day average positivity rate down from 23% to 18% in last 9 days, they expect the death counts to also take a downturn.
Our peak was somewhere around 15th. May 15th was our peak. It will take like 10 to 14 days for the death to climb up. Might take like 30 or maybe like first week of June for the deaths to climb down.
Even as we talk of deaths as an important reference number amid a pandemic, this mortuary is just one of the places where loved ones wait for that final glimpse of their family member whom they lost to the pandemic before the body is taken to the funeral ground. With camera person SP Babu, Sneha Koshi for NDTV.
With nearly 10,000 children catching the coronavirus in the month of May in Maharashtra's Ahmednagar, the state has started taking extra steps to minimize the impact of a possible third wave of COVID-19. Let's tell you how they are preparing.
Nearly 10,000 children below the age of 18 tested positive in Maharashtra's Ahmednagar district in the month of May alone, triggering the question, are these the first signs of a pediatric wave of COVID?
नगर डिस्ट्रिक्ट में पिछले 2 महीने में अप्रैल और मई में ओवरऑल पॉजिटिविटी ज़्यादा थी. उस कंपैरिजन में 8 से 10% नॉर्मल कोर्स में बच्चों का भी इसमें पॉजिटिविटी रेट 8 to 10% तक था. इसमें कोई ऐसे मेजर सीरियस कोई इंसिडेंसेस नहीं थे, लेकिन इस वायरस की एक स्प्रेडेबिलिटी की वजह से पूरी फैमिली पॉजिटिव होती थी.
State Health Ministry says percentage of children affected by COVID has not changed much. According to data, between January and May this year, 4.1 lakh children or young adults between the ages of 0 and 20 got infected. This translates to 10.79% of total cases. Between March and December last year, 1.96 lakh children were infected. In other words, 10% of children or young adults in this segment were infected.
अगर हम देखें कि एडमिशन मेन कोविड बड़ी फैसिलिटीज में जहां बच्चे भी दाखिल हो रहे हैं, बहुत छोटी प्रोपोर्शन % में, जैसे हम आगे बढ़ रहे हैं तो हर तरह के सिनेरियो के ऊपर नजर रखते हुए प्रिपेयरनेस को पुश किया जा रहा है. वी रीअश्योर यू कि पीडियाट्रिक पॉपुलेशन को कोविड के लिए जो जरूरत है वो उसका बंदोबस्त होगा.
Fortunately, the fatality rate in children is just 0.07%.
What we see in pediatric population, this population lacks the specific receptor which is essential to help the virus to bind with the host and multiply. So due to lack of this specific receptor, we are saying that the serious disease due to COVID-19 is very rare amongst this pediatric population.
Experts say that the parents need not worry, however also warn against letting the guard loose. The government also says that in case the third wave comes and it hits to children, it is fully prepared. With Sagar Dusal in Ahmednagar and Rajendra Dhyalkar in Mumbai, this is Purva Chitnas for NDTV.
The government has said that there is no shortage of vaccines, and by mid-July or early August, there will be enough doses to vaccinate 1 crore people in one day.
We have to remember that our vaccination is being ramped up, and by December we hope to have the whole country vaccinated. If we were not producing vaccines, imagine where would we be. So There is no shortage of vaccine. The shortage is what you feel if you want to vaccinate the country within a month.
So the government is saying that it will have enough vaccines to administer 1 crore doses a day. So let's hold on to that figure for a moment and see if we go by that figure from August to December, where do we stand? From 1st of August till 31st of December, at the rate of 1 crore per day, we would administer around 150 crore jabs. Then to achieve our target to vaccinate 108 crore Indians by year end, we need to administer somewhere around 41.39 crore doses in June and July, in 2 months. For that to happen, we need to administer 67.8 lakh doses every day in June and July. But right now, we are administering an average of just 24 lakh a day. Now, in a big relief to students going abroad to study, they can now get their vaccinations against COVID that allows them to travel. The vaccine camp for students was inaugurated in Bengaluru. 3 designated sites are open in Mumbai.
Madhusudan has been excited about his offer of internship at a San Francisco restaurant. But the pandemic and the difficulty in getting a vaccination for those under 45 meant his plans were on hold. The hotel management graduate from Bengaluru is relieved now. What did you plan to do otherwise?
I'm going on an internship, so it was like one of those opportunities which you get once in a lifetime kind of thing. So yeah, it was a lot of anxiety, but finally,
This long queue of people is a clear indication of just how much demand there is from students traveling abroad to study to get their COVID-19 vaccinations. They are relieved to have been added to the list of people under 45 who are eligible for the jab. It's a very long queue, and in case there's not enough time to give everybody their vaccinations today, they can line up again tomorrow to get their shot. Melissa was there to get her jab the first day that it was possible. She will head to Canada for her MSc in finance. And they're also shortening the gap between doses as well.
Yeah, that's the greatest news actually, yeah.
Demand of our students and the people who are employed abroad. So getting them vaccinated was the main important. They have to go back within the certain period. We have been constrained to reduce the period.
Even in less than 6 weeks, they will be able to get there.
The space between the first dose and the second.
In Mumbai, students thronged the 3 designated vaccination centres. 24-year-old Kanika Patil is planning to go to Vancouver, Canada for her Masters in Project Management. She is expected to fly by mid-August. She is worried about the gap between 2 doses.
Country which we are flying to, that hasn't given like an intimation of whether we'll be expected to have both the doses on board. So that's something which is really worrying.
Mustafa is flying to New York for higher studies in robotics. He stood in the line from 10 o'clock in the morning and is worried about whether he will be able to fly out or not, as consulates are closed.
Visa process भी pending है because vaccinations नहीं है available इतना, तो जो consulates है, American consulates, they are not opening up. वो लोग बोल रहे हैं कि हम डेट आपको देंगे, but there is no provision for that. Covishield सिर्फ इंडिया में मिल रहा है और बाहर नहीं मिल रहा है. So if we take first dose here, then हमें second dose भी यहीं पे लेना पड़ेगा.
Earlier, the BMC had said there would be only 50 doses per centre. But by the end of the day, 987 students had been vaccinated. Shiv Sena leader Priyanka Chaturvedi has asked for the time between doses for the students to be reduced. With Purva Chitnis in Mumbai, Maya Sharma in Bengaluru for NDTV.
Doctors across the country observed a black day in protest against yoga guru Ramdev's alleged remarks on allopathy. Here's a report.
Many doctors across the country observed a black day to protest against yoga teacher Ramdev for his attack of allopathy, especially in the pandemic, which has killed hundreds of frontline doctors, nurses and other health workers.
This black day is not against the Ayurveda. It's against Mr. Ramdev, demanding that he should apologize in public. If he is not going to apologize, then we can go to court also, or if required, we can go to any extent.
In Karnataka too, doctors protested at the Vani Vilas Hospital in Bengaluru.
Pan-India movement that all the doctors in India are doing today. This is with respect to the derogatory remarks made by Ramkrishna Yadav alias Ramdev Baba, made critical comments on COVID martyrs, our vaccination drive, our sacrifices, has been spreading lot of fake news.
In Gujarat, the Indian Medical Association and the Ahmedabad Medical Association have sought police action against Ramdev.
Yesterday, our Ahmedabad Medical Association with the Gujarat State Branch of Indian Medical Association have lodged a complaint in our police station over here in Ahmedabad against Ramdev, and we have asked them to take the strictest of the actions against him. Secondly, such kind of a person cannot go scot-free.
Ramdev was served a 6-page defamation notice, to which Patanjali confirmed that they will give them a befitting reply.
Doctors have been stretched beyond their limits in this pandemic. Several of them have even lost their lives. Doctors now demand a sincere apology from Ramdev for his remarks against the medical fraternity, especially at a time when there is fear and hesitancy regarding COVID. With Bureau Inputs and camera person Mursalin in Delhi, Shanakshi Chakravarti for NDTV.
It's time for a short break. Lots more on the other side. Stay with us. Welcome back. In a 9-point rejoinder, central government sources tore into Mamata Banerjee's account of the Friday incident. Government sources said that Mamata Banerjee has given entirely false statements and boycotted a meeting with Prime Minister Modi after agreeing to attend it.
This just retired IAS officer in the eye of a political cyclone. Central government sources rebutting his boss Mamata Banerjee's claims about the Prime Minister's meeting at Kalaikunda on 28th May, saying the officer was duty-bound to brief Mr. Modi on Cyclone Yas, but he did not do so and left the meeting with the Chief Minister without Mr. Modi's permission. Trinamool dismisses the claims.
My reaction is there any official document to establish all these things? If not, then the statement of the Honorable Chief Minister is to be taken in good faith.
Now, this officer show-caused under the Disaster Management Act 2005 for allegedly abstaining from the Prime Minister's meeting, punishment up to 2 years in jail and/or a fine.
This is the cause of action. I strongly feel that this has been done as an act of collusion against the state government, and teach lessons to the senior officials in this way. It is most unfortunate.
Nandigram MLA Shubhendu Adhikari and the governor who were present at the Kalaikunda meeting blame Ms. Banerjee for the situation. Not kosher, say former civil servants.
So this whole episode to me looks like shadow boxing. Bureaucrats, both retired and serving, should in some way show we are seriously into our job, and let's not be used by political parties for their vested interests, irrespective of the political party.
This is not going to be the last showdown in the proxy BJP Trinamool war. In fact, more collateral damage may be imminent. With Akhilesh Sharma and Saurav Gupta, Monideepa Banerjee, NDTV.
Well, that's it on this bulletin from the entire team. Thanks for watching. Goodbye.